Hello, I am Dr. Sanjeev Kumar Sharma. I am head of the Department of Bone Marrow Transplant, and today we are going to say a few things about bone marrow transplant. And bone marrow transplant एक वो प्रोसीजर है जो कि हाई ग्रेड ल्यूकीमिया में, लिम्फोमा और माइलोमा में यूज होता है. एंड दिस इज ए मेडिकल प्रोसीजर वेयर वी ट्रीट दी मैलिग्नेंसीज और ब्लड कैंसर्स. हमारे साथ आज हैं मिस्टर युद्धवीर सिंह, जो खुद एक स्ट्रॉन्ग आर्मी पर्सनल और एक लक्ष्य एकेडमी के डायरेक्टर हैं. उनको भी एक बीमारी एक्यूट माइलोइड ल्यूकीमिया जो हाई रिस्क का था वो हुआ था, एंड वी ट्रीटेड हिम विद हाफ पैच बोन मैरो ट्रांसप्लांट. सो उसके बाद वो ठीक हुए और अब उन्होंने 100 डेज कंप्लीट कर लिए हैं अपने बोन मैरो ट्रांसप्लांट के. एंड आई एम हैप्पी टू बी विद हिम, एंड वी एक्चुअली गॉट इंस्पिरेशन फ्रॉम हिम बिकॉज ही इज ए लीडर इन हिज फील्ड. And that makes us more happy that he himself, who is a strong fighter, fought with his blood cancer also, and now he is with us. And I would say that he should say a few words regarding that, how to deal with such high risk malignancies, how to fight, and one should be mentally and physically, but more mentally strong to deal with such malignancies.
Hello, as you know, sir has already introduced me. The first thing I want to say that what caught my imagination and what impressed me the most about the hospital was that divinity in healthcare. This is easily said than done, but I think, I'll be very frank, that doctors here believe in this. And they act up to the literal meaning of the word. I say that because when I came here, I thought I will be fighting this disease. Fight was always on right from the word go when I came to know that this is a problem. And I was hoping to have a team, and with doctors, with staff, everybody, we will win this. That was right from the beginning. So I hoped for a team and found a family, because Dr. Sanjeev and Dr. Anamika, they did not treat as a patient, but as a family member, and they were always available, always. In fact, I remember one day when at 2:30 or so, one of them came over and from house, and they were alarmed as to what is happening. Halanki, it wasn't so bad. So that is the first thing I would say. Secondly, my problem, because people who are watching, everybody is so scared about cancer. Obviously, there are no sure-shot methods to tackle, and there are more fatalities. But one thing is, which I found in my experience, that if you tell yourself that this cannot put me down, and I will fight and be a winner, I don't think cancer has a mind of its own to fight my mind. And of course the medicines will do the job. In fact, I remember when first time I was told that you are going to live only for 6 to 9 months. Incidentally, there was a quote on the wall of that doctor's clinic which said that you are not identified by the disease that you carry, but you are identified by your character. And I knew my character very well. In my own teaching of last so many years, I have always followed that, taught that, professed that. That once you decide, your mind has power of its own, and nobody can stop you. So, and one practical hint I want to give to those who feel that this is a very big thing. I always thought of post curing what I will do. I never thought of anything negative because I had made up my mind. I was only fighting the present. If I am having weakness, I am trying to discuss and figure out how to solve that weakness, how to stop the stomach ache, how to fight nausea. I am not sure, but I think most of the people not only are fighting the present, they are also fighting a black future. Because they are thinking, अरे कैंसर है, मर तो जाना ही है, ऊपर से ये हो रहा है, so double whammy. You are actually fighting two demons, and then you will become weak. I never ever thought of that. If I thought about post cure, post treatment, it was only doing something better, making a YouTube channel, talking to people, making them aware, and also planning my own things. And that's it. So these are the two major things that I can tell, because there is a paucity of time here. So I will stick to that. And thank you very much, Dr. Sanjeev and Dr. Anamika. She used to get too excited whenever there was some improvement, and I could see her twinkling eyes. I'd say, oh, some good news is coming. And Dr. Sanjeev, of course, he's so open, accessible, and amenable, and very encouraging. And he will discuss. You ask any question. In fact, he encourages you to ask questions. ये पूछो. So one only feels कि नहीं और क्या पूछना, इतना busy है क्यों पूछना. So thank you very much.
So hi, I'm Dr. Anamika Bakliwal. I work as an associate consultant in the Department of Haemato, Oncology and Bone Marrow Transplant. The unit is headed by my head of department, Dr. Sanjeev Sharma sir. You've already heard from him, and our patient, actually I won't call him our patient, Colonel Yudhvir Singh sir. He himself, as sir said, is so inspirational and so motivational in so many ways that he teaches us how to live life to the fullest. And of course, today is his day. He's completed 100 days of haploidentical transplant. That too, it's been an atypical transplant where the donor was his nephew, which is, again is an atypical thing in many ways, as sir will agree. But having said that, he's overcome so many challenges. It's been a very turbulent journey, but sir, with his motivation, and you've already heard from his speech that he's come across all the hurdles and come out as a winner. So I'll just request everyone out there that don't ignore your signs and symptoms, whether it's fever, bleeding, or any weight loss, loss of appetite, drenching night sweats. Just come and meet your hemato-oncologist, and then we'll take it from there. And also, don't be scared of any kind of blood cancers. We are here to help you. And though I'll say transplant is a tedious process, but once you go through the journey, there's nothing like it, and you will be free of cancer. So you will. Yeah, please do.
एक इनकी बात से मेरे को याद आया कि वो बहुत इम्पोर्टेंट बात है कि हमको हमारे देश में डॉक्टर्स और पेशेंट्स और उनके रिलेटिव्स और पूरा समाज, हम सोचते हैं कि हमको कैंसर हुआ ही नहीं, और ये जितने लोग मैंने मेंशन किए, ये सब हिचकिचाते हैं कैंसर के बारे में बात करने से, और वो अगला बुरा ही मान जाए, वो उसके जो रिलेटिव्स हैं वही बुरा मान जाए, तो डॉक्टर्स भी, और फिर कई बार देखते हैं हेल्थ तो ठीक लग रही है, तो ये कैंसर को आई थिंक वी शुड स्टार्ट एक्सेप्टिंग इट एंड स्टार्ट एटलीस्ट टेस्टिंग द थिंग. फॉर एग्जाम्पल, माई blood levels were very low, and I was also not ready, because I am also part of the same society. तो एक डॉक्टर के पास में गया, I told him, I said ये blood level भी नीचे लग रहा है, मुझे पेट में थोड़ी सी प्रॉब्लम ये हो रही है, गैस्ट्रो के पास गया because पेट में प्रॉब्लम है. But he also never thought that it could be cancer, because it was, the blood levels were so low, and they were indicating something, not वेरी सिंपल. सो बट उन्होंने अभी यही बोला कि नहीं, ये तो गैस्ट्रो का प्रॉब्लम है, ये इसको ये खाओ ठीक हो जाएगा. When I went to another one, even he said so. And finally, after a delay of 2 months, it was detected.
Yeah, I would like to say कि हमारी सोसाइटी में एक्चुअली एक अवेयरनेस की कमी है. यहाँ पर ब्लड कैंसर्स को एक तो थोड़ा सा डिटेक्शन में भी कई बार डिले हो जाता है, क्योंकि लोग कई बार पेरिफेरी से आते हैं तो इस चीज़ को इग्नोर करते हैं. दूसरी बात ये है कि डायग्नोसिस में टाइम भी लगता है, पेशेंट का सपोर्ट, डॉक्टरों का सपोर्ट, और एक अच्छी जगह पे और बड़े हॉस्पिटल में जहाँ पे ये फैसिलिटीज हैं वहाँ टाइमली पहुँचना बहुत ज़रूरी है. सर हमारे पास टाइमली पहुँचे, वो भी 3-4 हॉस्पिटल के बाद हमारे पास आए. हमने भी वही चीज़ें डायग्नोसिस की कि ल्यूकीमिया है. Then we did whatever best. उनको पहले 3 महीने के करीब कीमोथेरेपी लगी. उसके बाद फिर बोन मैरो ट्रांसप्लांट के लिए हाफ मैच फुल मैच था नहीं, रजिस्ट्री में भी डोनर अवेलेबल नहीं था. फिर हाफ मैच ट्रांसप्लांट किया गया, जिसमें भी कई तरह की कॉम्प्लिकेशंस, CMV, GVHD जो नॉन कॉम्प्लिकेशंस हैं वो भी आई. बट सर क्योंकि उनका मोरल सपोर्ट और उनका अपना मेंटल इतना स्ट्रॉन्ग था कि मैं जीतूंगा और मुझे जीतना है, और उसी सपोर्ट ने इनको आज यहाँ पर लेके आए हैं. और हम सबको बहुत खुशी है कि आज वो 100 डेज ट्रांसप्लांट के ठीक ठाक कंप्लीट कर रहे हैं. तो लोगों को अवेयरनेस की जरूरत है और उनको ये होना चाहिए कि डॉक्टर उनके साथ हैं, बस लड़ना है और जीतना है. तो ये सब करके आई वुड लाइक टू थैंक सर, डॉक्टर अनामिका, थैंक यू.